Hello, this is Dr. Sarah. I thought I would make this video for you to add to your information kit about how to take the NCLEX test, and this is the non-traditional approach. And it is the why of why you're taking this test and how it works and that sort of thing. A short history about the nursing board test, as they have been called, is that a long time ago they were just really a review of everything you learned in nursing school. Now it's gone full circle and it doesn't have anything to do with what you learned in nursing school, except how to apply what you learned in nursing school. So it's sort of a whole different viewpoint, and it evolves over the years. And 10 years from now, it won't be the same as it is now either. So the probability that your professors took this type of test is unlikely unless they're under 30. If they're over 50, or 60 especially, they didn't take a test anything like this NCLEX test. And your teachers and professors will not like this video. Why is it that you even take this test? Testing for licensure is done by many professions. Now, it's all not done for the same reason. See, doctors, nurses, plumbers, building contractors, realtors, a whole group of people have to take a test in order to have a license. In order to work, each state has different reasons and different requirements to take all these professional tests. The NCLEX test is basically a national test, but each state has their own requirements for licensing. You have to pass the test in order to be licensed, but each state has their own particular licensing requirements. Then there's a number of states for nursing that are all kind of grouped together. You don't have to get a different license to practice in that state. Most of the tests are given to establish a standard of competence or a standard of skill, and each professional test has a different reason for giving that. Say, like building contractors, their skill level is can they find the codes that are required for a particular thing they want to build, because the codes change every year or so. Unlike nursing, what the nurses are being tested on is competence as far as can you take what you learned in nursing school and apply it to the situation in the hospital, the clinic, or wherever. Now, the NCLEX test is really given so you can pass it, because there's an average of about 85% of the students who take the NCLEX the first time pass it, as opposed to some others, like doctors. Depends on where you take the test. Some states make sure that only a certain number of doctors, say cardiologists, are admitted to practice in that state. Say California, New York, Florida. They not only give the test for competencies, they give the test to keep you out of the state. So it could be that in a given year or a given time that they only want, say, 30% of who take the test actually pass it. So that will limit the number of cardiologists in that state. Now, that's not the only profession that does that. Contractors do the same, and sometimes it's as low as 5% of the people taking that particular test are going to be allowed to pass, because they're trying to limit the number of contractors in that state. All that sounds very stupid, but that's the way it is. You think you should be able to pass the test and practice in that state, but that's not the case. A big question is, why is the NCLEX test the way it is? Why do they want you to know analyzing things, applying what you know, and all that? It's because nursing has been under a lot of pressure from all groups, especially nursing schools, hospitals, all kinds of clinical applications. What they're trying to do is reduce their liability. Suppose you're administrator of a hospital. You have lots and lots of nurses. That's your major group of employees in your hospital. Well, you don't want to hire a new nurse unless you are pretty certain that they're not going to cause you a liability, like hurt a patient or something like that. And administrators, government, the public, all kinds of places are putting pressure to make sure that the nursing student who comes out of a particular school can pass a standard test and be able to function without putting the employer in a liability situation. So you think, well, we're not going to intentionally do anything to hurt somebody. That is not the point. Can you inadvertently, by your lack of knowledge to apply what you learned, put the hospital or the employer at risk? Some years back, when all this started about the pressure, they adopted a more broad reason for taking the test, and that is to do no harm, which is really the basic principle of medicine and of all health care. So what they're wanting to make sure that you do is do no harm when you have now taken the test. As you already know, the NCLEX is made up of different levels of difficulty. I don't look at it as difficulty, but that's how they define it. Like I said earlier, if you went to nursing school and you passed everything well, then you should be able to remember or have memorized a lot of like anatomy and physiology and different lab values and this and that, and understand. The test is made up of questions that are what they call non-passing questions. If you kind of imagine a line in the middle of halfway down a page, and there's a line in the middle, everything above that line is standard questions, and everything below that line is non-standard questions. And the non-standard questions, which just means it doesn't count for passing. So those are the memorized things that you learned, memorize like you learned anatomy and physiology and stuff. And the understanding, did you understand what those parts of anatomy actually did? Now you get to the next level, they call it levels like I said, that can you apply what you just knew, what you learned. They spend most of the time in nursing school trying to get you to memorize and understand what it's all about. But when you get out in the public and go to a job, you need to know how to apply and to analyze what you learned all about. So that's why they are putting it that way. If you can apply something or analyze a problem that you're looking at or a situation, you are likely to do no harm. If you have no idea how to apply it or analyze the situation, then you possibly could make the wrong decisions. I knew a professor who taught anatomy and physiology in medical school. He was extremely bright when it came to memorizing stuff. In fact, he knew verbatim Gray's Anatomy, which is a huge anatomy and physiology. But if you ask him an application question, he just didn't know a thing. So if I'm an employer and I'm going to hire this guy, I wouldn't even do it. I don't care how many books he memorized. To me, he's a liability. That's the reason why students who've done really well, exceptionally well in memorizing everything, may have gotten straight A's in nursing school and then have difficulty passing the NCLEX if they don't understand, do the applying and analyzing of what they learned. Another part of how the NCLEX is made, besides these different, the remembering, understanding, applying, and analyzing, those are the types of questions, and then each test has to follow what they call the test plan. What the test plan is that you have to have been given at least questions from each of the major groups, which means safe, effective care, which is management of care, which is 20%, and safety and infection is 12%, health promotion and maintenance 12%, physiological is 43 to 70, which is broken down into 4 categories. Basic care is 9, pharmacy and therapies is 15, risk potential is 12, and adaptation is 14. Now, every time you're given a question and you answer that, then the test has to maintain these percentages in the whole test, which is the reason why the whole thing looks like a bit confusing. Why would you have a test question that says something about brain surgery and another question, the next one, have something to do with OB? That doesn't make any sense at all to you. But that's the reason. It seems like it skips around, but it's a reason. It's trying to maintain this plan that it's built in, and so at any point in time, the computer says, they've ascertained that you actually do know your stuff, and so they can cut you off, whether it's at 75 questions or 265. These percentages and other information about the NCLEX is given, you can find it on the computer, obviously, at National Council Licensure Examination. You can find it in the Wikipedia and other places. So it's readily available. I was just explaining this to you so you'd understand why this hopping around or strange things seem to be happening in the test. I've taken many different kinds of professional tests, and the NCLEX test is certainly not the most difficult. And the reason being, I stated earlier, is really made to pass. It is given by a company that just does testing for all sorts of places, states and agencies and this and that. So Pearson VUE, they don't really have anything to do with how the test is made up or anything. They're just a big company that administers tests. Now, the way tests are made, I was explaining to you the 4 categories, but before the questions even get on the test, they have to go through a whole long process. I've been on a committee that established testing questions, and so what happens is there's a group that is professional test questions makers. They know nothing at all about the content. So they get the content from, in this case, nursing educators, and then what is the whole point in the test. So they make the test questions, then they send them back over here to this group, and they'll see if that's a reasonable question. So it's just not a matter of, like your professor has done ever since you've been in nursing school, make up a test and give it to you. So it's not done like that at all. The end result or the end question is really not up to the nursing educators. It's up to, as long as the content is there, it's up to the group that has the professionals who make tests. And that all that seems to me rather stupid, but that's the way they do it. If we're all up to the nursing educators, they would make it all about nursing process and about nursing theory and all this stuff that has nothing at all to do with the bedside nursing or what 95% of the nurses are going to do when they get out of school and start a job. But they do have their hand into the advanced programs in nursing, which does not require a license, like the BS in nursing, Masters in nursing, and all that. So if you want to get into more of those aspects of nursing practice, or then you have to take a BS and maybe a master's or even a PhD. As far as I can see and as far as I can tell, the best thing to do if you are going to get an advanced degree is getting into something that complements nursing and not is more, unless you just want to be a professor, then you got to do it in nursing education. But if you want to run something, you need to get, say, a BS in or master's in business or something that's going to complement nursing. I hope this has been helpful because I think if you understand the overall picture of what testing is it won't give you the heebie-jeebies while you're taking the test. The more you know about why you're taking and what you're taking, besides the subject matter, because you've gone through this school, you know that. It's a little bit confusing when you don't know the whole story. So good luck on your test.